Good morning, Patrick here from Complete Health. I just want to ask a question. Do you know someone, or maybe you are someone, who has seen a doctor and pretty much the only option you've ever been given is either drugs or surgery? So has there ever been a time where you've attended your doctor for some sort of problem, whether it's a knee problem, a hip problem, low back problem, and the only solution that's ever been offered to you is drugs and surgery? So this is something that I see in my office all the time. That a patient will go in and see a doctor and say, for example, they might have something like a low back problem, or they might have a knee problem. And the doctor's first initial point of call is to give them some sort of drug, whether that's naproxen or gabapentin, sometimes it's cocodamol, or they sometimes just recommend over-the-counter prescriptions of paracetamol and ibuprofen. And that patient will take those drugs and it doesn't improve the problem. And so as a result, they end up going back and they might, if they're lucky, get imaging the second time. And then they'll find maybe potentially some wear and tear on a joint. And so their only solution then is to then put you through X. So occasionally you might get the order of, they give you drugs, then they give you physio, and then they give you surgery. However, in my experiences, I'm seeing this a lot more often now, that they're just going straight to doing replacements without ever giving the patient any other options. Now, interestingly enough, I worked with a gentleman last year who had a problem with his knee. And we started doing his neuro exam, and there was just some abnormalities in his reflexes in his lower limbs, especially on the side that he was complaining of in the knee complaint. And so what we did is we did some x-rays of his lower back. Now, this gentleman never knew that he had a fracture in his lower back, but this gentleman had a small fracture in the lower back and had actually moved the joint enough that it was potentially putting some pressure on his nerve roots. So what we started doing is we started managing and stabilising and moving the joints in his lower back. And interestingly enough, without ever touching the knee got better. And the gentleman never ended up having surgery on his knee. However, sometimes what we do is we look directly to the site of the pain or directly to the site of where we think the problem is, but we can occasionally end up missing the biggest thing. So if we never thoroughly examine, or we never thoroughly manage or treat or go through a course, because what we know is that if we're going to heal any tissue, it is going to take time. Now, actually, some physiology textbooks will say that healing can take anywhere from 6 months to a year and a half, even for just a soft tissue or muscle, if the injury has been there long enough. So it can take anywhere from 6 months to a year and a half to properly heal tissue. And so if we're just going to give someone drugs for 2 weeks and then physio for 1 session, and that has not solved the problem, is that realistically going to have worked for a tissue that may take anywhere from 6 months to a year and a half to heal? Now, the thing is tissue will only heal if it's in the right environment. So if we're constantly stressing out, it will not get better. And this is what chiropractic teaches people is, 1, how are we going to fix the problem? We try and solve or resolve the thing that's triggering the problem. 2, how do we maintain those tissues? And 3, how do we then create an environment in our body that will continue with that healing process? Whether that's to do with diet and nutrition, whether that's to do with exercise and strengthening, whether that's to do with flexibility, etc. That is the principle of trying to teach people's body to do things naturally, as opposed to the first thing we do is go under the knife. So this guy is now playing, like I say, football. Again, not currently now, but has been playing football since he started care with me. And he was at the point with his doctor that he was just about to have the knee replaced. It's not been replaced. He's still playing football. The knee is not giving him any problems anymore. Low back doesn't give him any problems. We've got some other blips that keep coming in, but the guy is actually doing so much better than what he was doing when he first came into the clinic. So don't always think that surgery and drugs are your only option. There are other options out there. Sometimes you just have to push your doctors if you're looking for a referral pattern, or you can always go private, where they'll actually probably take a little bit more time, care, and attention to understanding your problem. If you need any advice, please leave us a comment in the comments below or send us a private message. I'll be happy to answer any questions that you might have. Patrick here from Complete Health. I'll see you guys again soon.